Hello, everyone. Thanks very much for tuning in and having a look to this presentation that I'm going to be giving today, which is about supporting people who've experienced traumatic events. And it's a presentation on a toolkit that's been developed by the National Centre for Mental Health. And hopefully it'll provide some support and some help for people working with individuals who may have experienced traumatic events. So my name's Dr. Thomas Hoare. I'm a clinical psychologist and I work for Traumatic Stress Wales, which I'll go on to talk a little bit now. So Traumatic Stress Wales is an NHS All Wales Quality Improvement Initiative. And the idea, the kind of core idea behind TSW is that we're looking to try and improve the health and well-being of people affected by traumatic events by looking at kind of streamlined care pathways, improving access to psychological therapies, improving support, supervision, consultation, and so on. So we're looking at trying to kind of develop streamlined care pathways for individuals that have been affected by traumas. And we do this from the sort of preventative end to the kind of provision of psychological therapies. And we do this via kind of multiple work streams, which are made up of people from across disciplines, plus people with lived experience, and are cross-sector as well. So we've got representation on those work streams from health, from government, from local authority, the third sector, and so on. So we've got good representation on those work streams. And we've got a number of different work streams. We've got a criminal justice work stream, perinatal, sexual assault, refugees and asylum seekers, children and young people, and then there's an outcomes and data set work stream as well. And the way that kind of TSW is organised, we've got a hub which is based within CTM, Cwmtaf Morgannwg University Health Board, under the Welsh Health Specialised Services Committee. So there's a small hub team of us, which again is kind of multidisciplinary. And we've also got local leads across all of the different health boards across Wales, who are leading on how the pathway can be kind of realised for people who've been affected by trauma locally across different areas of Wales. And those leads are also responsible for kind of local implementation groups, which take into account the representation on the work stream. So again, criminal justice, perinatal, and so on. Just to let you know also that this recording, this presentation is going to be available on the Traumatic Stress Wales website, and the link is here at the bottom of the page. But it's also meant to be an accompanying piece to a talk by Professor John Bisson, who's the Traumatic Stress Wales director, and he's done another talk on supporting people affected by traumatic events, where John has outlined sort of PTSD, complex PTSD, and a number of kind of psychological first aid strategies that can be used, but has also given some more context to the TSW initiative there in that talk. So this is meant to be an accompanying piece for that talk. So just to let you know that there are two key documents that have been developed by the National Centre for Mental Health. There's a resource called the Supporting People Who've Experienced Traumatic Events document, which you can see here on the left-hand side. That's an extended document that goes into a lot more detail about signs and symptoms of post-traumatic stress disorder. And then we've also got another accompanying toolkit, which is what I'm going to be sort of going through step by step today, which is far more strategy focused, and it's a briefer toolkit that's got a number of different strategies designed for people working with individuals who might have experienced trauma. So the document on the right hand side is the document that we're going to be talking about today. So, who is this presentation for? Well, it's aimed really at anybody working with people who are experiencing distress in relation to to being exposed to traumatic events. It's aimed to be a stabilization type intervention. So it kind of sits between the more sort of universal, empathic, preventative approaches, such as psychological first aid that John has talked about in the other talk, but it sits between that and more specialist evidence-based interventions such as cognitive behavioral therapy or eye movement desensitization reprocessing. So this is intended to be a kind of stabilization type intervention. And crucially, some people, and I think this is really important to emphasize, is that some people will need additional support. So the development of this toolkit and this particular recording is by no means intended to replace a whole systems approach. So services will need to employ, sort of supervision, reflective practice, training, a trauma-informed culture in a team. All of these things are really important for supporting people who are affected by trauma. But this is just really designed to provide a few key strategies that people can use. And importantly, the previous talk that John has done, that provides an overview of the ways in which being exposed to traumatic events can have an impact on the body and the mind. And this talk, which focuses much more on the toolkit, will focus more on those strategies. And really importantly, the toolkit has been translated into multiple languages with the support of the Welsh Government, and uh, uh, all of these languages are available on the Traumatic Stress Wales website. So there are a number of different sort of languages that the toolkit has been translated into. So yeah, just to flag that up as well. So in terms of the content of this talk, the kind of core aim of the discussion is to kind of highlight some exercises which are described in the toolkit that a person can use to help support and provide some temporary stability for someone who might be in distress. Um, and these skills can be sort of taught and demonstrated to people, but it's really important to again emphasize that such skills have to be practiced regularly if they're going to be at all useful. So quite often you might hear that people struggle to use these exercises when they're feeling acutely distressed. And what, sort of I think an important mantra is that these exercises have to be practiced when people are feeling sort of calm and stable, in order to then be useful when someone might be feeling more distressed. So we're going to look at the following skills within the talk. We're going to look at firstly, we're going to look at a breathing exercise, then a relaxation exercise. There's a tool that's looking at kind of reminders of traumatic events. There's more of a grounding exercise. Um, then we'll go on to talk about helping someone who might be having a flashback or might be dissociating, and I'll explain what those are. Um, And then we'll look at some activity planning and ways in which people can manage strong emotions. So hopefully those skills will be covered. And as I say, these are the skills that are covered within the toolkit. Okay, so first off, I think it's sort of a relatively sort of straightforward exercise, but again, the crucial thing about a breathing exercise is to practice these breathing exercises when someone's feeling calm and someone's feeling safe, and this makes it far, far easier to use the technique when someone might be feeling anxious and panicky. And really what it's sort of aiming to do is to try and kind of regulate someone's breathing. And breathing is one of those things that can become very dysregulated when people are acutely distressed as a result of, so sometimes as a result of being reminded of a traumatic experience. So what you're really asking the person to do is to breathe in slowly and steadily for a count of 3 through the nose. So, and then breathing out slowly and steadily for a count of 6 through the mouth. And you're asking someone to kind of keep repeating this until they recognize that their breathing sort of slows and they're feeling calmer. So you want to sort of encourage a person to practice this on a number of times, and also notice that when someone tries to breathe out, trying to push out the air so that someone's tummy expands rather than their chest. And furthermore, if someone's attention is wandering off from their breathing, then just asking them to gently bring it back to their breath. So you're really asking people to practice that strategy for a few minutes until someone is feeling calmer. So again, that breathing in slowly through the nose for 3, and then out through the mouth for a count of 6. Again, just to re-emphasize that it's important for somebody who is working with someone who may get kind of regularly distressed, that the important thing is just to keep practicing this when they're feeling calm. So that's what's going to make it much more easy to access when somebody is feeling maybe distressed. Okay, so that's the first exercise that I wanted to look at. Now, the second exercise again is focused in initially about breathing. So starting off by helping someone to get into that kind of regulated kind of breathing pattern. But this is much more about a kind of body relaxation exercise. And the way that you would go about doing this is to start by encouraging someone to get into a comfortable position. So making sure that they're kind of seated, really comfortably, and initially then asking them to breathe in slowly and steadily for a count of 3 through the nose. So, and then out slowly for the count of 6 through the mouth. And you're asking someone to do this a few times until their breathing has become slow and regular. So you might want to try and do that for a couple of minutes in the first instance. So just focusing in on the breathing, 3 in through the nose, and then 6 out through the mouth. Now, once someone's done that for a few minutes, then you're asking someone to direct their attention towards their feet. And what you're asking someone to do is that as they breathe in for that for a count of 3, asking someone to curl their nose down and press their feet into the floor. So breathing in, pressing your feet into the floor, and then breathing out and relaxing your feet. And the idea is that this helps the person sort of go through that process of tensing parts of their body and then relaxing them. And this is part of that kind of relaxation strategy. And you might ask someone to repeat that step a few times just so that they get used to it. So again, breathing in through the nose, out through the mouth, tensing their feet and then relaxing them. And then as you go on to step 9 here, you'd be asking someone to breathe in again. And as someone does, tightening up the muscles in their legs by pushing legs together. So breathing in, looking to kind of tense those muscles, and then breathing out and try to kind of relax legs completely. So again, just like with the feet, breathing in and tensing the muscles, and then out and relaxing. And you move from your feet to your legs, and you might do a few practices on the feet and then a few practices with the legs. And then you might move to the tummy muscles. So tightening up your tummy muscles as you breathe in and relaxing them as you breathe out. And then similarly, moving on to the arms, bending them up, bending your arms at the elbow and tightening all the muscles from the fingers to the shoulders, doing that and breathing in. And then relaxing them completely as you breathe out. And then moving up to the shoulders and hunching them up towards your ears before letting go. So again, breathing in and tensing your muscles and tensing your shoulders, and then breathing out and relaxing your muscles then. So you'd obviously in this exercise want to go at the rate that somebody wants to go to, and you'd want to be making sure that someone's focused in on their breathing first. But generally the principle is, as you're asking someone to take in breaths, you're asking them to tense either their feet, their legs, their arms, their shoulders, and then as they breathe out, relaxing again. And again, you know, this exercise is such that, you know, much better to practice this when someone's feeling calm and in a you know, in a calm and relaxed place. And hopefully the idea is that as someone gets used to practicing this strategy, they'll be more able to utilize it as they, you know, in situations where someone might feel particularly sort of distressed. So hopefully that's given you an idea about the body relaxation exercises that can be used. So we're going on now to talk about thinking about reminders of a traumatic event. Now, sometimes people find this is helpful to begin to sort of articulate and begin to sort of clarify and describe what specific triggers people have to traumatic events. And this can help give people sort of clarity, because I think once people have a sort of sense of what things might trigger memories or trigger flashbacks, um, um, it can be more straightforward to then do something about those things. So this tool is about sort of trying to kind of ask a person to begin to, you know, pay a bit of attention to what might trigger traumatic memories and traumatic flashbacks. And these things are often sensory reminders. So when we're sort of thinking of our senses, of what we can see, hear, smell, touch, and taste, you know, often those are the things that are reminding people of traumatic events. So, so things that might sort of trigger traumatic memories that people might see. So people might see images in newspapers or particular objects or people, but it can be things that you hear, such as footsteps, door slamming, particular music. Sometimes, you know, sometimes things that people smell, so aftershave or the smell of sweat or petrol, things that taste can be very evocative, so particular types of food, and you know, things that you touch. So for example, when people brush past you, or something that's more sort of tactile in terms of its sensory. So but also of course, kind of reminders might be sort of feelings and sensations. So, you know, heart beating very quickly, or feeling a sickness or nausea, that can also be a kind of particular reminder of a trauma. So what this tool is trying to do is to try and kind of help someone to begin to kind of organize a little bit about what are the things particularly that might trigger these events. So as you can see, this sheet on the right hand side, and again, this is in the NCMH toolkit. It asks someone to kind of start to think of specific examples, things that they can see, hear, smell, touch, taste, and then feelings and sensations as well. And kind of linked to that are some, and this is the fourth sort of tool that's in the articulated in the booklet, are around grounding using kind of particular senses. So as in the previous exercise, once someone has begun to notice what are the senses that kind of bring back those traumatic memories, it's possible to then start to think of ways about helping someone ground themselves in the present time and remind oneself that they're feeling safer now. And this can involve focusing on what you notice around you, and it helps also to use all of your senses. So how can you ground yourself? So this it's about helping someone to bring themselves back into the room, back into the kind of present moment, rather than experiencing that sort of flashback, which is, a flashback's a vivid experience where someone might kind of relive particular aspects of a traumatic event and feel like they're living in it right now. Or, sometimes people might hear this word kind of about dissociating, and that's about sort of feeling disconnected from the world around you. Now, these sensory strategies can often help bring someone back into the room and ground them in the kind of present moment. So things that you can see, so people can encourage people who might be going through that kind of slightly dissociated state, or having a flashback, to encourage someone to sort of focus on what they can see in the room or their surroundings. So looking at pictures or objects or furniture. If someone's outside, they can focus on things like shop fronts or road signs or cars. And these are things that might help to remind you of where you are and that you're in the present time. But of course, this is going to be sort of very particular for particular people. So, some people carry around photographs of themselves or have photos on their phone, and these will also help sort of remind someone that they're safe and that someone's survived that traumatic experience. And similarly, sort of things that you can touch, like there might be something with different textures, like clothings or surfaces, things that you can hear, so voices or the sound of a computer, or some music. Sometimes people find that sort of particularly evocative smells like Vicks or smelling salts, coffee or perfume, all of these things, and taste, and things like sort of mints and something with strong flavors. And sometimes people find sort of moving around, standing up or leaving the room can also be helpful. So these are all ways, I suppose, that again, if someone's going through that type of experience, some of these things are helpful for people to be able to bring themselves back into the room. Now, as I said in the previous slide, a flashback is a very vivid experience that someone might have when they feel like they're reliving a traumatic event. So they feel like a person might feel like they're actually in that moment again. And dissociating is when someone feels very disconnected from the world, and does and feels sort of slightly detached from what's going on around them. Now, this particular tool number 5, just some sort of steps to help if someone is having one of those experiences. So, I mean, I'll just go through it bullet point by bullet point, but it can be very alarming for someone if they're experiencing, and if someone's with someone who experiences a flashback or a dissociating kind of experience. It can be very alarming for someone with that person, but I think it's really important to try and stay as kind of calm as possible, even though it is alarming. Um, you can gently tell that person and explain to them that they might be having a flashback or that they might be dissociating. Remind them of where they are and what the date is. So that's, again, helping people to sort of ground themselves, in what's going on in the present, in the moment. Encouraging the person to breathe slowly and deeply. So again, that sort of 3 breaths in through the nose and 6 through six, count to six when breathing out. Encouraging the person to describe their surroundings using their different senses. Encouraging the person to use their grounding strategies to bring them back to the present. And again, reminding them that the frightening event is now over, that they've survived, and that they're safe in the present time. And again, these are just steps that people have reported finding very, very useful. And if the person who's with if the person is with you, if you've got a good relationship with a person who's going through this, it can be helpful to kind of know what things help for that individual. So I think that's a really important point to flag up. So hopefully these are some steps that can help someone when they're with a person who might be having some of these experiences. Now, another thing that can be sort of very useful is to think of some activities in advance, and having a kind of balanced set of activities. This is really important for people whose circumstances might have changed quite a bit as a result of experiencing a traumatic event. So sometimes people have to give up things, and they might be things that someone used to enjoy. But it's a good idea to have a kind of few senses from a person, and this can be very individualized. So thinking about relaxing and comforting activities, watching a favorite film, or having a bath, or having a hot chocolate, something that's encouraging someone to feel relaxed, kind to themselves, and comforted. Some social activities, so maybe that can be sort of doing a team sport, meeting up with a friend for coffee, doing something sort of social, and then making a list of kind of achievement activities as well. And sometimes an activity planner like this just helps give a bit of kind of structure, and again help someone to think through a few things that they can do that might have been disrupted as a result of experiencing that traumatic event. So yeah, this is again tool 6 on the NCMH toolkit. And step number 7 is about talking about managing sort of particularly sort of strong emotions, such as anger. So particularly sometimes sort of people feel very angry, understandably so, as a result of their kind of traumatic experiences. And this tool is just really sort of designed to encourage people who might be working with someone who's or has a relationship with someone who's going through a traumatic event, that there are things that person can kind of do to help manage strong emotions. So recognizing the early warning signs of anger and strong emotions, and helping to think of these as being like a thermometer, so being like sort of 0 degrees to 100 degrees. And it can feel for certain people who might have been through traumas that they can feel like they go from feeling fine, 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 fine to 100 degrees of anger straight away. It can feel very, very quick for some people. But there are ways to be able to kind of spot sensations or feelings that will give them a sort of early warning system to that. So if people can kind of again, if you've got a good relationship with the person, beginning to kind of recognize what the triggers for anger, what the triggers for other strong emotions are. And this metaphor here about sort of surfing your feelings like waves, that can be sort of very helpful for some people. For other people I know, there's often the metaphor of like being like sort of shaken up like a kind of bottle of Coca-Cola, and taking the lid off bit by bit. So having that sort of opportunity to sort of talk things through, that can be kind of very cathartic as well. So encouraging a person to prepare for how they will handle these situations and what they'll do if they what will happen if they don't go according to plan, using time out from a situation if someone needs to calm down, and again going back to the kind of relaxed breathing, relaxed body technique to help calm down the sort of threat system in the body, and again teaching the brain that you're safe. Talking to someone, as I said, can really help, and help calm in a situation, and also sort of taking regular exercise. Exercise is often cited as one of the most important things that you can do to help reduce stress. So these are some things that anyone can do to help others manage those particularly strong emotions. So I hope that that's been a helpful sort of summary, and um, I've just gone through a few of those exercises that are being presented in the NCMH toolkit, and hopefully given a bit of a demonstration about how to help someone when they feel distress related to a traumatic event. But really importantly, again, some people are going to require extra support. And sort of signposting people, so knowing where people can go to get that support is really a really important part of psychological first aid, and it's useful to kind of make sure that you're familiar with where a person can get additional support if they so need it. And it's worth having a read of both of those booklets that I kind of that I flagged up at the initially, so the supporting people who've experienced traumatic events toolkits, and the kind of the other booklet as well, and those can be found on the National Centre for Mental Health website. And just to let you know that the Traumatic Stress Wales website has additional resources. So if you go to the All Wales Traumatic Stress Quality Improvement Initiative under NHS Wales, that's got a load of additional resources where which address some of these issues around safe destabilization type of techniques. So I really hope that that's been a helpful summary, and diolch yn fawr, thank you very much, and yeah, and thanks for watching the film.